course.
All right. Fausto, we're just allowing for people to sign in.
Mm-hmm.
Sounds good.
Letting folks jump on.
Hope everyone's doing good.
Let's see. Hope everyone is doing well. Just waiting for folks to come on in. Happy Thursday.
We'll give it how many minutes here?
Hope everybody's week has been well. We're already almost towards the end of August, so that's crazy. But we're here
And
today.
tomorrow's Friday.
Tomorrow's
Woohoo.
Friday. Woo! Can we get some hearts in the chat? There you go for the Friday. There you go. Almost towards the end of August. Almost. And then right around the corner, 2025. But hey, we're not talking about that. We're talking
Yep.
about
Day.
today. I also
You
try to
deny.
deny it too, Melissa, but sometimes we have to meet reality where it's at.
Yep. Time
But
flies. Woohoo. Thank you guys for those emotions. I feel it. Thank you.
and so we're just giving a couple minutes. Yeah,
Hey,
we got
Ashley
IHP. Woo
in the
woo.
house.
So we're just giving some folks some time to go ahead and hop in.
Woo.
We'll start in a bit. I hope everybody has their coffee, their tea. I know over here on the West Coast it's 1:20.
Yeah, I
I
have
know we I,
water. I don't know about you. I can't do
I got
coffee in the
I
heat.
got my coffee. It's midday.
Mm-mm. Water. Lots of water.
And on the East Coast it's a little later. What,
Agüita fresca.
4:19 out there?
Okay.
All right. What do you think, Erica?
Yeah,
Should we
I mean, I
start? Give it
think,
a few
yeah,
minutes?
whatever you think.
All right, we'll give it 2 more minutes just in case there's anybody else, but curious how the week has been for everyone.
Or if you have plans this weekend, what we got going before the kids go back to school, or if they already went to school.
Hmm.
Well, thanks everyone who's joining. I appreciate it. Yes. Busy, busy, busy bee, everyone.
That's the life of a CHW.
Yeah, right. Mine's always running. It is. Hard work, indeed. Thanks, Ashley.
All right, so we're gonna give it about a minute.
I hope the music in the background is relaxing. So excited.
Miss Ashley, a lot of love sending out good energy to Trona. Shout out our Trona team. Oh, there's no music.
Oh, no.
Well, I hope our words can serve as music to your
To your
ears.
ears, right?
Uh,
There we go, Fausto.
all right, y'all. So we're gonna go ahead and get started, just to be mindful of time, so that way, there's other presentations that are gonna be on today. So I hope that y'all are able to find value in the information that we have to say today. We do want to express the gratitude of just being able to be here and share with y'all this information about IEHP, who we are, the alignment of work that we are doing right now as CHWs out here in the Inland Empire, Southern California region. And we also just want to acknowledge the fact that we are speaking to the experts, which is you all, right? And so within all of the information and knowledge that we shared today, some of you might be doing what we're doing already in some way, shape, or form. And we hope that at the least that we're able to share our perspective and the way that we're doing things. And maybe you take away something new, something insightful, something innovative for you all to take back to your own regions, areas, organizations within this amazing and meaningful work that we're all contributing to. So, our presentation is titled IHP, the Health Plan with a Heart, CHWs Making a Difference, Making a Change. And so I just want to go ahead and quickly share a little poem that I wrote. I was inspired yesterday night just to go ahead and write it. And so, I just wanted to share kind of what that looks like in a poem form. So the poem is titled Community Health Work. And it goes, community health work, a form of labor that fills the heart, that fills the soul, breaking down the barriers that act as tolls to the people in our community. Whether it be an elderly woman, a young man, we act through compassion and empathy, seeing our grandmas, our siblings, our children, in each face we encounter, each story we hear, lifting the weight of their burdens, standing near. We walk the streets with purpose, with pride, bridging the gaps where these systems divide. In our hands, hope becomes real. In our hearts, a promise to heal. For in the work we do, we are more than just workers. We are the lifeline, the voice of those who cannot speak for themselves. So let us carry this torch with strength and grace, knowing our impact reaches every space. For every life touched, every hand held tight is a testament to our collective might. We are the heartbeat of our communities, and with each step forward, we forge new opportunities. In a world that often forgets, we remember. In a system that often fails, we stand. For every life we uplift, we redefine what it means to truly stand together. So I just wanted to go ahead and share that with y'all. Feeling inspired just to go ahead and self-express what this work means to us. And so with that, I want to introduce myself and my wonderful friend here, Miss Erica. My name is Fausto Figueroa III. I am from a small valley out in the Southern California region in a hot, hot desert called the Coachella Valley. I'm from a rural area, an unincorporated city called Thermal. So you can still see horses being rode next to the tractors on the dirt walkways. I'm the oldest of eight. I graduated UC Berkeley in 2018 with a degree in Chicano Chicana studies. So I tell folks it's not a pipeline career, it's more of a lens on how to see society and the world around us. Uh, Within all of my experiences growing up, going through foster care, having been taken away from my parents because of addiction, having to just navigate these barriers that life has put on our path, it's really inspired me and encouraged me to pursue being able to destigmatize and have conversations around mental and emotional health. And especially as a Latino male, I feel like it's just important to be able to have and destigmatize these conversations within our communities and communities of color. And so outside of my community health worker hat, I do own and operate a social coffee business with my brother called Café Empatía, Empathy Coffee. And so the whole idea and concept around that is being able to bridge specialty tea and coffee with bringing awareness around mental and emotional health. And we do have a really good Café de Olla cold brew. Not me trying to promote that here nationally, but uh, outside of that, I do also consider myself a poet, a student of life. And so, because of that, I love and enjoy hosting open mics in my community to be able to uplift and encourage the youth, the adults to go ahead and just put themselves in a state of being vulnerable, to self-express their own truths and to share their light with folks around them that are able to create that safe space. Because as we all know, as we become adults, we get caught up in the vacuum of life. And so it's important to just keep in touch with that inner child of ours. So I love being able to just do that for other folks. And um, that's a little bit about me. So I'm going to go ahead and pass it away to my lovely friend here, Miss Erica.
Thank you. Hello, hello, everyone. Hola, ¿cómo están? I hope everyone is doing well. Yes, my name is Erica. I am so excited to be here to share with you guys what we are doing here in IEHP as community health workers and assisting our communities. So thanks again for the space, for your time, and for your great energy. I hope that wherever states that you are from, I just want to send so much love, positive energy from sunny California, kind of hot, but still really sunny. And so, a tidbit about me, well, I've been married almost 20 years. Been a wonderful journey for sure. I have two teenage daughters and a son who is now an adult. So, definitely motherhood has been challenging and wonderful. I would say it's probably my most proudest work that I have done yet. And I was born here also in California, actually LA County. I was raised in the Inland Empire. I'm actually first generation Mexican American, which I'm so proud of. Everything that I do, everything that I have, and everything that I am, I owe it all to my parents who did struggle and who faced many challenges being immigrants here in the United States. They faced and overcame many challenges such as language barrier, culture change, no social support, no family nearby to help, having to work long hours to make our modest life, meet and to supply for our family. So I thank them so much for their tenacity, for their determination to provide us with this life that we now have. Interestingly, though, as a child, I didn't really understand the severity of their challenges until I got a little older and I started to take notice. And as most first generation immigrant Americans, I started to feel a bit of a pressure, but a good pressure, almost like you just wanted to overachieve and be great and help because to take that burden off of your parents a bit. Why? Because we don't want to let them down, and we want to make sure that we take every opportunity that we have and take advantage of it, because they sacrifice so much for us to have this life that we live. Um, I now realize, though, that going through these difficulties, I was cultivating qualities in which now they're very useful in my life, right? Resilience, persistence, learning to be empathy, having love for one another, all who ultimately shape the person who I now am, a promotora de salud comunitario. I'm a community health worker, and really thinking about this upbringing that I had, I think about a quote by Dr. Joe Dispenza, where he says that the best way to predict the future or your future is to create it. And As my parents always reminded me that you have great opportunities, you have potential, I now enjoy doing the same to others. I'm in a path where I can empower others and for them to see their potential and the opportunities, connect them with those opportunities. So by building these trusted relationships in the community, providing support, advocacy, and motivation, it brings me so much joy to bring positivity to the community's life, a person's life, whether it's a small gesture of kindness, a great resource connection, or even just empowering them to be able to take their steps to better their health. I absolutely enjoy being part of this. And I always thought it was so cliche to say that one person can change the world. But until I became a community health worker, I believe that. And we are all here. We're all community health workers, National Association of Community Health Workers. So we're all individuals who can change the world. And even if it's not the entire world, you're changing a person's world, which adds up. And so I'm so glad to be here to share this space with like-minded hearts and to have and to be here and connect with you. So I hope that whatever we have to say and whatever we have to share with you serve you in your wonderful work that you are already doing in your communities. So I hope you can find a gem in this. And thank you again for the space. So, who are we? Well, we are IEHP, and that is Inland Empire Health Plan. Oh, Inland Empire Health Plan. We are a nonprofit managed care health plan for Medi-Cal members in the Inland Empire. We have a great network of resources and providers here in the IE who provide quality care for our members. In 1996, IEHP began their journey to help the community, to help them thrive. They started off with 63,000 members, and now we serve over 1.5 million members across the Inland Empire. We are really a health plan like no other. We're always looking upstream, being motivated, and looking for ways to grow and ways to help the community. Here at IHP, we really do have a collaborative team culture. We have various departments within IHP where we can look to work together, bring our minds together to be able to meet the members' needs. IHP really does believe in the work that we're doing here with community health workers. Just want to take this moment to just appreciate and thank leadership there at IHP for helping us being fully equipped to go out there and do what we're doing in the communities. If it wasn't for them, they've done so much for us. So I do really, truly appreciate them providing us with the skills, knowledge, education. So thank you, leadership at IHP. You are truly appreciated. And that speaks to the core of who we are here at IHP, and that is our MVV, which is our mission, vision, values. IEHP is actually known to have to be the health plan with the heart. And that's really what the essence of a community health worker. Our vision here, our mission here is to heal and inspire the human spirit. The vision to not rest until our communities are enjoying optimal health. And our values are really derived from what? Doing the right thing, always doing the right thing and being committed to our members, to our providers, to our partners, and to each other. So, with that, what are we going to get into today? Let's see. Our objectives today will be that we want to recognize how we are addressing social determinants of health in our urban and rural communities. We will also mention the impact IEHP is making to address the needs of those who are affected by the high mortality rate of perinatal African American Black women here in the Inland Empire, and the impact that we are making to assist those struggling and suffering with food and nutritional insecurity. Lastly, we would like to share with you how your organization can leverage your healthcare managed care, plans to implement these programs that focus on the social determinants of health. So I hope you enjoy this. Fausto, let's get us started, if you
Let's
will.
get us started. So here we just wanted to give an overview of the Inland Empire that consists of both the San Bernardino and Riverside County. And for those of you who don't know, San Bernardino County is the largest county in the United States by landmass, meaning if we were to compare 5 states on the East Coast to the San Bernardino County, Those would be the equivalent of how big the San Bernardino County is. Or we could also say that San Bernardino County is just a bit smaller than the country of Ireland. So if San Bernardino county wanted to be its own small country, then they would definitely be able to make that up because of its size. Uh, and we mentioned this because you can imagine if if a county is considered that big, especially with the different geographic landscape of Southern California, you can imagine just how much work might go into being able to reach and support these communities, especially those who are rural and lack adequate resources and infrastructure. So, our rural health initiative consists of different areas that are outlined in a red box, which is Trona, Needles, Blythe, the Coachella Valley, Paris, and Barstow. The black dots are simply indicating neighboring cities in the area, and the stars on the map are the current locations of our CWCs, our community wellness centers, which I'll talk a little bit more about in the upcoming slides. And in the next slide, if we also just wanted to show some of the pictures of the different rural areas that we are serving, because a lot of times when folks think of California, they think of the beaches, palm trees, Beverly Hills, right? But we really wanted to show the lived realities of the many communities that spread across the Southern California region. And on the left, we have the city of Trona. On the top right, we have Blythe, and right underneath Blythe, we have the city of Needles. And we highlight this because our work as CHWs in rural areas is to support and be a connection point for our members and these communities, especially especially because these are the regions that are underserved, lack resources, doctors, specialists, and a lot of times, these are the barriers that folks face, which in a sense unmotivates them to drive an hour out of town to see a doctor, or they purchase local produce from their liquor store because of the food desert that exists in their community, being that the supermarket is 30 minutes away, 45 minutes away from their home. And so, as CHWs, we simply want to be a bridge in these gaps, right? And be of support when it comes to looking for resources that'll uplift the community members' well-being. And so with that, uh, we want to touch on our community health department and the different programs that fall under it. So within our community health department, which started in 2018, we do have a few programs that allow us to connect not only with the community, but that allow us to also build relationships with our community-based organizations, the CBOs, right? And house our own programs and resources within our own community hub, like the CWC, the Community Wellness Center. And so our partner community reps play a huge role in developing and building rapport with local organizations to coordinate and facilitate events that allow us allow for us CHWs to be present and connect with members face to face. They're they're the ones that are behind the scenes and doing the front end work and getting all of the paperwork, all of the logistical information that needs to get done for us to have a presence at these collaborative events. Shout out our team rep, Miss Gabby, for always pulling through with all of these things for us. And lastly, we have our community wellness centers, or as we call them, our CWCs, which have been fundamental in creating space where folks can receive education, information, resources. Folks can go to a CWC and take a cooking class that'll give them a better idea as to how they can cook a nutritious meal for someone who has diabetes. Zumba is a really big thing at the CWC. So if you like some reggaeton, some Shakira, Hips Don't Lie, and want to join a group that meets consistently, the CWC has a schedule of different activities they hold. And we do want to mention that the beauty about our CWCs is the fact that these spaces are open to the public and our members, which create a sense of empowerment to the community as a whole. And I also want to mention that a really useful service for IEHP members is the fact that because of the Medi-Cal benefit of transportation services, IEHP members can utilize the transportation service, call ahead of time, and get a ride to and from the CWC for these resources and activities, which in a sense helps eliminate the barrier of transportation issues. Uh, We do have CHWs present at all the CWCs as well, in case folks need one-on-one support in person. And the neat thing about some of our CWCs is the collaboration that exists with other organizations. So CWCs will offer a space in-house to different organizations on the premise that they provide free resources to the community, which I think is pretty cool given it really does take a village. And last but not least, we have our social and community services program where we as CHWs fall under. And the biggest thing about our SCS program is the idea that we work directly with the members and non-members. So members are able to put a face to a name with IEHP through us. And I do want to mention that when we first started this program with CHWs, the program only started off with 3 to 5 CHWs who were all located at the CWCs. Fast forward 7 months from now, from January of this year up until now, and we have just a little over 40 CHWs in our program, which is pretty amazing to me, given the fact that we have little less than a year with this program, and to make sure that we were ready uh, as CHWs for this kind of work, we all did go through a certification program through IEHP that gave us a toolbox to educate our members on their health, whether they have diabetes and don't know how to manage it, or if they've recently been diagnosed with asthma. We have the capacity to educate members on how to navigate certain medications and how to manage their asthma. We also conduct screenings and assessments to make sure that we're meeting the member where they're at, and to make sure that we're able to identify any needs that might not be met, like food, nutrition and security, transportation needs, following up with home visits with the members at their home or at a local community space like Starbucks. And in a sense, we also advocate for our members in their areas where they might not feel supported, like going and accompanying a member to their doctor appointment, right? Because making sure that they might feel heard and understanding that they receive the information and understand what the information they're receiving from their medical provider, because sometimes the language barrier is also a barrier in itself, right? And so um, as we go on to the next slide, uh, as CHWs, one of our biggest tools in supporting our members is our social determinant of health assessments, or as we call our SDoHs. And these assessments allow for us to understand and meet the member where they're at in terms of what their needs are, right? These are important because oftentimes members might be struggling in other areas of their life outside of their health. And as we know through Maslow's hierarchy of needs, which basically says, it's hard to elevate ourselves to other needs within our life if the basic needs aren't being met. Um, so Estos give us the clarity and the direction in which we can support and refer our members. And it's by doing these assessments and having meaningful dialogue with the members that we can understand how to support folks and meet them where they're at. And like I mentioned earlier, because we as CHWs have a range of skills and we're all aware of that, uh, we can help we can help navigate folks uh, through these different skills, especially being from the same community as the members. We can uplift and support folks by connecting them with resources that help with utility services that we know of, housing programs, chronic conditions, food and nutrition insecurity, and any other questions that are within our scope of work and wisdom, right? And lastly, any issues or needs that we're able to, we do refer our members internally to our different departments, such as our behavioral health department, our maternal health department, our members' PCPs, their primary care physicians or specialists, and any other external resource or partner that we're aware of. And I do want to add that it is within all of this work that we have to remind ourselves, even though we have a broad range of skills and wisdom that we carry, it's also, just as important to remember that where we might need to ask for help or know the limits as to how much we can help or support, right? Because as Erica said, this is heart work, es trabajo de corazón. So as much as big as a heart that we have, we can't do everything. And so, the biggest example that comes to mind is just like the housing crisis and just how much need and how much big of a gap there is for that within our communities. And so sometimes just knowing where to refer members and where to send them and being able to to step back and say, I'm not that expert in this, but I can send you to someone, or I can connect you with someone that is an expert, goes a long way. So, and now Miss Erica is going to talk a little bit about Black infant health.
Yes. Well, thank you, Fausto. I did also want to add that as a community health worker, you are that lifeline that transforms lives. You ignite hope. You bring essential need to those who need it the most. You empower persons and communities in ways that are nothing short than heroic. So, again, reminder that you are amazing and you're doing amazing things. So thank you so much for that. And now we're going to go into what we're doing in our part to resolve social determinants of health and needs in our needs with the Black infant health. It's a very important topic to really discuss. Some may go blind in regards to this is not really happening, but it is. And we want to share it with you. There's a wonderful video we want to share with you that really draws it to the point of why we are really reaching out to this population, why we've made it a focus to reach out to this population, because it is a crisis and it has our attention. So I hope this can help you.
Now on to the silent crisis in our nation's maternity wards. African American mothers dying at a higher rate than any other racial or ethnic group from childbirth-related complications. Families affected by this tragedy share their stories on the day their lives changed forever. Janae Norman has this report.
What was supposed to be the start of a new life turned out to be the end of another. 26-year-old Amber Rose Isaac was preparing to give birth at the height of the coronavirus pandemic in New York City in April, when everything changed for her partner Bruce.
And I just remember staring and, looking at her face and seeing how scared she was, panicking a bit. So I'm telling her, yeah, we're going home. This is what we prepared for. This is what we were ready for. It's time. And she looked at me and said, yes, all three of us are going home. And that was the last time I seen Amber.
Amber posted on Twitter about, quote, dealing with incompetent doctors. She died 4 days later. Bruce says Amber tried advocating for herself, but doctors just wouldn't listen.
But she voiced her concerns to her OB. She was letting her know, she's not feeling right. She's feeling a lot of discomfort. She's having shortness of breath. And her OB didn't really understand. She was like, oh, well, there are other women who are working while they're pregnant. So that right there just told me she didn't really care about Amber.
In a statement, the hospital spokesperson saying 94% of our deliveries are minority mothers, and Montefiore's maternal mortality rate of 0.01% is lower than both New York City and national averages, adding any maternal death is a tragedy. Amber's story is not uncommon. July 2nd, 26-year-old Sha'Asia Washington died during an emergency C-section. And July 27th, Yolanda Kadima, a doula and mom of 7, died giving birth to twins, also during an emergency C-section. Experts like Professor Deirdre Cooper Owens, who's written about how race and gender impacted American gynecology, say the struggles these women face throughout their pregnancies and childbirth all come down to racism.
You see that class and status tend to matter. The higher up you go, right, the kind of better protected you are. That doesn't exist for Black women because we're all experiencing racism in the same way. So when I walk into the office, nobody knows if I'm married or have a PhD or what my income is. The assumption is I might be lying, maybe I'm promiscuous, maybe I don't eat well. I should still be given fair treatment and equitable treatment by my doctor.
My first pregnancy, my birthing experience was pretty traumatic.
And he actually punctured my spinal cord. I was temporarily paralyzed.
We were so excited about bringing Jace into this world, and then the last 2 or 3 days of his birthing process was too tragic.
I was bullied and I was abused emotionally and physically, in the sense that consent was not asked for as often as it should have been.
It took me a while to find a provider that I trusted and that respected me.
We lost him due to what is known as HELP syndrome. We found out later on that his death could have been prevented, as well as the traumatic birthing experience that she experienced.
So many Black families with similar stories, and these experiences add to a mistrust between the Black community and the medical community, a relationship with a long, dark history dating back centuries.
Enslaved Black women were experimented on, particularly during the 19th century, so a little bit in the 18th century, but largely in the 19th century, as obstetrics and gynecology became more formal and accepted branches of medicine. Marion Sims, known as the father of American gynecology, pioneers the surgery to correct this obstetrical fistula condition. People didn't know that he experimented on enslaved women. They didn't know that 2.5 years into his experimental trial, when his white medical assistants quit, he trained these enslaved women to serve as nurses. They were still his patients. They were still his slaves that he either owned or leased, and they still served as surgical assistants. So that part of the story was left out.
The success of James Marion Sims earned him the nickname of the father of modern gynecology. But his legacy is marred by the fact he earned it on the backs of Black slaves through non-consensual human experimentation without anesthesia. Now, doctors like Jennifer Lincoln, also an OBGYN, are fighting against present-day health disparities.
To this day, Black people are less likely to get the same treatment in terms of pain medication. They're more likely to wait longer in the emergency room. They're less likely to be taken seriously. It's a holdover from the days of slavery. And in my field, this plays a huge role in the Black maternal and morbidity crisis. The call to action: doctors, nurses, anybody in the medical field, check your implicit bias.
Staggering statistics show Black women in America die during childbirth nearly 3 times more than white women, making the United States one of the most dangerous developed countries in the world for Black women to give birth. And doctors say the issue for mothers extend through pregnancy and postpartum, and also impact Black babies, who are more than twice as likely to die than white babies.
So higher rates of complications related to childbirth and pregnancy as well. It's huge, and it's something that in a population, childbearing women in general are young, healthy women, and then these are not women who should be suffering these extreme complications or be dying, especially in a developed country.
So what do you think can be done for medical professionals already out there to address this?
I think that in reading and listening and understanding why there is fear and distrust of the medical system for certain racial groups, and it's not a personal thing, but it's a whole generational and societal thing, I still have to stop myself every time I'm caring for somebody who looks different than me, and I always check. And I say, am I delivering the same level of care here?
These important self-assessments could literally mean the difference between life and death for patients like Charles Johnson's wife, Kira. She died unexpectedly after the birth of their second son in 2016, and Charles says her death was 100% preventable.
For what was supposed to be a routine scheduled C-section at our doctor's recommendation, and on what we expected to be the happiest day of our lives, and really walked into an absolute nightmare. The thing that's so clear to me is that Kira just wasn't seen and valued as human. She wasn't seen in the same way, with the same compassion and the same empathy that the people that were responsible for her life would have seen their own daughters or their own wives or their own sisters. There's no reason that Kira should not be here today.
Charles says for him and his 2 sons, the void left by Kira's death can never be filled.
And we talk about mommy all the time, and so I made the decision very early on that I never wanted the topic of Kira to ever be taboo or to be off limits. We do our best to remain positive and to celebrate her, but my brother says it best, it's like there will always be an empty seat at the table.
But he's using tragedy as fuel to affect change, starting 4 Moms for Kira, an advocacy group aiming to change laws and prevent negligence from ripping apart any more families. As for Bruce, he's grappling with the reality of what should have been the start of his family ending tragically in the beginning of his son living a life without his mother.
Now, all I can think about is, Elias growing up without his mother and how he's gonna feel when, he's in school and they're doing Mother's Day activities and, making Mother's Day cards, and Elias is not gonna have that luxury, and it kills me. It kills me that whenever we go out to parks, we're gonna see full family playing together, and we're not gonna have that.
Janae Norman, ABC News, New York.
Our hearts go out to those dads. Such a heartbreaking report. Our thanks to Janae. Now on to the silent crisis.
Yes, so yeah, that video really just highlights the troubling truths that that is being experienced in this Black maternal health crisis. And for them to say that he won't have the luxury to have his mom, it shouldn't be a luxury, right? This is not just a health issue. This is a human rights issue. Can you just imagine having this happen to your own, to your wife, your sister, your mom? This is not okay, right? And us as CHWs, when we see that there is a need, a population in need, we focus on that. And it's not saying we don't, that's our only focus and that's our only end tunnel vision, but they do need our immediate intervention. So events like this really just reminds you and makes you reflect of how there's so much inequities is being experienced by many people around in this population. So we need to take initiative. So I implore you that look into your medical health plans to see what initiatives they may have or how can you start one, right? As you see here on the screen, the fact that here in California, Black women account for 5% of pregnancies, but make up 21% of pregnancy-related deaths is staggering. More than 80% of all maternal deaths can be prevented. So what can we do? What can we do as community health workers? Because we can reduce the maternal mortality. We can improve the quality of care, and we can ensure that Black mothers and their babies have a healthier and safer outcomes. Why? Because we play that essential role in addressing this crisis. How so? Well, we provide them with those resources, the awareness, the education, the support and advocacy. But how are we doing it here at IEHP? Well, there's several ways that we are doing it here at IEHP, actually. Through our health informatics team, thanks to that team, every month we're provided with a list of members within IEHP who are either identified as Black or African American or are pregnant or just had a baby. The goal is to reach out to them, ensure we reach out to them. If we didn't reach out to them and didn't make contact one month, we'll try again next month. But we want to reach out and ensure that we make that connection so we can provide them with the wealth of resources and opportunities that are available to them to help them make this journey a safe and positive experience, as it should be for themselves and for their family. We connect them and educate them on our doula benefit. We would refer them to county and statewide income and health programs. And we would also, of course, connect them with our internal IEHP maternal health team. So let's take a look at the doula benefit. This is a covered benefit from IEHP for all of our expecting mothers. We ensure that we educate them, let them know what this is. Some may not even know, never heard what a doula is. Doulas provide education, advocacy, physical and emotional support, helping mamas to create a birth and postpartum plan. So we ensure that we connect them with an approved doula to help them support them during this pregnancy. If approved, this member can receive up to a year after postpartum to ensure that she's feeling well, that she's getting connected to resources needed, because we know it's not done once you give birth, right? There's still time that the member needs to be assisted. And so that's what we would like to do. We connect them with them. They help the members to navigate through feelings, through the health system, through maybe options that if things don't go as planned, help them, educate them with what other options there may be. I'd like to recognize, in doing this presentation, I want to recognize one of our team members, Kiki, who actually became inspired and motivated by her own trauma to become a certified doula herself. So before giving this presentation, she shared with me her story and allowed me to share it with you. And it's very moving, actually. She was actually carrying someone else's baby. She was a surrogate. And even through her selfless act in using her body as a vessel and helping another family fulfill their dream to become parents, she too was mistreated and unheard, all because of the color of her skin and lack of cultural competence. See, the medical staff didn't know that she had a degree, that she was educated, and that she worked for the county. They just saw a Black woman cashing in and birthing someone else's baby. And that's not okay. Kiki eventually had this gut feeling. You know that gut feeling when you just know something is wrong, something about whatever is going on in your body and anything, you know something's wrong. Well, that gut feeling is telling you something is happening. As she expressed this to her OB, she wasn't heard. Her voice was also silent. Doctor shrugged it, paid no mind, did not listen, right? Kiki then figured out that, or the doctor eventually figured out that her blood cells, her white blood cells were dropping so low to the point of infection. Doctor didn't catch the infection on time. And unfortunately, due to that, Kiki lost the baby. What a painful experience. But this experience did motivate her to become a doula. Now she's empowered to empower other Black women, to help them find their voice, to advocate for them and to ask the right questions, to not be silenced. This is what it is, right? We have to be, they have to be listened to. And we have to be the ones to connect them and help them find their voice. And sometimes that's what we have to do. So this is just an example why the doula benefit is a very special one. It could be the very cornerstone as to how we can alleviate the crisis. So, and next I would like to go over how that we also submit referrals to the state or countywide guaranteed income programs. See, these income programs help alleviate some financial burden that some may be experiencing during pregnancies. Though this is a lottery based, but if selected, the member can receive up to $600 a month for 18 months. The strategy of this income program is to provide this unconditional cash to ensure and to prevent stress during pregnancy, allowing mother and birthing parent to focus on themselves and the baby. Because it is known that high stress on a birthing parent can decline the health, in turn cause babies to be born either too early or small. This program gives mamas the resources really to help themselves and the baby, setting them up for a chance at a healthy start. So these guaranteed income programs are great. There may be some in your location. Ensure you're connected to them and you're referring your community or this population to them. Next, we have our BIH program. This is the Black Infant Health Program. This program provides perinatal and postpartum support and education. This group has sessions of topics such as breastfeeding, stress management, SIDS awareness, family planning. This program is also supported by social workers or nurses who help with chronic disease prevention and connecting to resources. The goal really is to have a safe and successful delivery. Overall, the program is really to empower the pregnant and mothering Black African American women to lead healthier lifestyles, to create a positive and stronger connection to others in the community who are also going through the same journeys and experiences. I was privileged to help a member earlier this year, and she assisted this program and she absolutely loved it. She said she felt like it was a supportive sisterhood and it was a place where you can laugh and cry, relay experiences to each other, inspire and encourage one another. She says that women now from that program, even though they don't go there anymore, they still connect. And it's really encouraging to me to see how these programs are bringing women together and making lasting connections and relationships, really, to support one another. Lastly, I'd like to highlight our very own maternal health team. We are very privileged to have a department like this in IEHP to assist us with the population, this population. This team helps us, supports us, and if for members who are facing challenges as the ones that you see on the screen here, from domestic violence, substance abuse disorder, those experiencing traumatic deliveries, or even those who are experiencing homelessness. One of my team members, Yvonne, also shared an experience with me. She works at the high desert, and she related that through the informatics list that we have, she was able to connect with a mother who identifies as Black or African American. She was in her 40s, 8 months pregnant, and has 4 children. However, she was homeless and living in a car. As Yvonne was talking to her, member mentioned that she hadn't been receiving prenatal care. You know, living in the desert, you also are resources are very scarce. There's limited connections. Isolation is real over there, right? So she didn't find a provider that she felt connected with her or understood her or had her best interests. Just like the video, there is quite a lack of trust with the medical personnel. So thankfully, she did accept Yvonne's help, and Yvonne was able to link the member to a medical group that specializes and supports Black pregnant women. And this was a success story. So now, because of this help that Yvonne provided, mom and baby are connected with the right provider. And this is very encouraging. So you can make a difference. So I encourage all of you to address this crisis and ensure that all Black mothers and babies are getting the care that they deserve and need. So thank you for this part. I will send this over to Mr. Fausto, who will be telling us a bit about how we are helping our communities who are facing food and nutritional insecurity. Fausto?
Yeah, thank you, Ms. Erica. And so we do want to highlight that food and nutrition insecurity has been a gap of need where we have been able to connect with the members and where they're at. And so in this next slide, food distributions for us as CHWs here at IEHP have been a tremendous connection point with members, especially in the more rural areas. For example, when we first started outreaching to members, when the program initially started, we did encounter some barriers trying to connect with members, being that we would receive these lists, right, with folks that had chronic conditions from our health informatics team. And when we would call, some members were skeptical, cautious about us trying to confirm their date of birth and last 4 digits of their social security number over the phone with someone that they didn't know. But as we progressed with the program and work, we eventually began noticing the success of connecting with folks at food distribution sites and being able to follow up with them a lot smoother than simply calling them and outreaching. And so with that, some of our CHWs in different regions attend weekly food distributions, being able to connect with members and non-members and create, a relationship, put a face to a name, to be able to follow up afterwards, to assist and support them. And like I said, and by doing this, we've been able to find a big success in it simply because of the fact that we're able to connect, right? And I feel like that's the biggest gap that sometimes in connecting with resources it lacks. And so because this is hard work, we do care, we do want to know what the follow-up was, and what the outcome was for the member, for the community member. And the cool thing is that if a member cannot go to a food drive because of health conditions or transportation issues, we as CHWs can initiate the extra effort to deliver any food boxes to members. And so we have our lovely Mr. Kevin over here posing in front of one of the food distribution sites. And And so in this next slide, in being able to meet members at the food distributions, we do understand that in order to address members' health and healthcare needs, it is important to address that food and nutrition insecurity is a basic need. And addressing food and nutrition will allow us to meet the member where they're at. And so here we wanted to highlight the different cities in which the Bienestar food drives happen in both the San Bernardino and Riverside County. So it happens in a few cities out in the San Bernardino and Riverside area. Uh, and in collaborating with Bienestar, IHP, just to give you all a little bit of numbers, but IHP has been able to serve over 5,000 members on a weekly basis. So I know on the site it says 1,000 members, but you know, if you five up that, if you take into consideration a family, what we engage with is normally a family of 3, 4, 5. And so, you know, sometimes when we're doing this kind of work, you know, that it's important to remind ourselves to fill up our own cup, right? Because sometimes it can be draining, it can be exhausting. And the whole purpose of doing this and sharing this information is to give you all a perspective of the bigger picture, right? So that way we can not only focus on what we're doing on the day to day, but we can kind of take a step back and look at the bigger picture. And so, for instance, if we're serving 5,000 members on a weekly basis, that 5,000 in a week turns into 20,000 a month, which turns into 240,000 members a year. And so, you know, when you put things like that on the micro, sometimes you say, man, I helped one member today. I could have done more. I could have done this. But then if you think about it and you put, you know, you put that one in a day into 5 days a week, that's five in a week. You put that five in a month, you know, that's 20%. So, you know, it just you start seeing the ripple of the impacts that, you know, we as community health workers collaborating with organizations like Bienestar can have an impact. And so we also just want to highlight that these food distributions wouldn't be able to happen if it wasn't for the collaborative effort that goes on behind the scenes, right? Because some of these food distributions wouldn't even happen if it wasn't for the involvement of churches and community-based organizations to provide the space to host these events. Because with Bienestar, it doesn't even happen on IHP grounds. It happens on grounds where folks are allowing the space to go ahead and do this kind of work. So in this next slide, we have what's in the box, just to give you all an idea of the variety of food items that are being distributed on a consistent basis. And so I'm personally a fan of colors, as you can tell by my yellow shirt. I also love colors on my plate. And so in being able to see, you know, the different fruits, vegetables, boxes that are being offered here, uh, we're able to see kind of just the different things that are being given to our community members. And so this is important because, you know, sometimes when we go to food drives, food distributions, and we're given a box of food that has canned food, you know, we're told to be grateful for what we have. And absolutely, we are. But at the same time, if somebody has diabetes, high blood pressure, you know, has some kind of chronic condition, and they're consuming this kind of food because that's all they have, then it begs the question, what can we do different for this need? Because, you know, oftentimes food like canned food, although it's preserved and we can hold on to it for, you know, a long time, it also has a lot of sodium. And so just trying to keep these things in mind when we're trying to create this kind of support for our community members, and then thinking about their health as a whole. So as we move forward, we just wanted to go ahead and share with y'all this video that we have from our Bienestar food distributions, so that way y'all can go ahead and get an idea as to what that looks like, and just to share with you all through our own eyes what we see. So, Miss Erica.
So food is something that every single person, regardless of their socioeconomic status, regardless of where they live, regardless of what job they have, everybody needs food. It's something that really is an equalizer for us in many ways. We all eat. There's no way around it. And so everybody needs food.
The reason why I started when I came to work for Bienestar Wellbeing is because I want to help people. I wake up every single morning, I go to different sites that we have, and we help a lot of families with the food distribution. Families that, with the economy that we have, that are struggling right now, and they need food, not only for them, but sometimes for other families and neighbors or different members that they have in the family.
La razón por la que decidí compartir lo que obtengo es porque hay muchas personas que no manejan, no tienen comida, no tienen hijos, no tienen ningún beneficio de comer saludable, y es por eso que yo quise acercar a su casa lo saludable para que tengan.
The fact that Bienestar has come and partnered with IEHP to have these fresh food distributions, to me it's extremely amazing. Typically, individuals who are a lower socioeconomic status, who have less money, they are relegated to getting food that has all of these preservatives in it, right? But with Bienestar partnering with IEHP saying, you know what, individuals who have less money should not have to have less quality of food.
Now that I hear that I can have that benefit for insurance, not just for me, for my entire family, great, super great.
Gracias a las verduras que me dan, no solamente voy a poder tener la ayuda en mi alimentación, sino también mi seguro médico. Y para eso poderme atender bien para mis hijos, el venir a apoyarlos también me está ayudando para conseguir mis beneficios médicos.
They talk about how it takes a village to raise a child, but it absolutely takes a village to have optimal health as well. As the health plan, we may want to do everything, but we can't do everything ourselves. And there are great organizations like Bienestar that are already doing good work. And if we can partner with them, then we're working smarter and not harder. And we can reach more lives, we can help more people, we can feed more people, and we can encourage more people to follow through with their health care and really achieve optimal health.
Yeah, so we hope that you enjoyed the Bienestar video. And again, we just want to show you all the work that's being done out here. And like we mentioned earlier, maybe a lot of this work is work that you're already doing in your areas. And so the whole idea is to, complement one another and see how we all can go ahead and do our work a little better, a little more efficient, a little more collaborative. And with that, we wanted to just pose a question to the chat. So we do encourage y'all, if from different areas, just to go ahead and answer the question in the chat. And towards the end, if we have a little bit of time, we'd love to just, mention a couple of them. But we wanted to ask, how are you all engaging your rural population for better health outcomes? And so in whatever way, shape, or form, we'd love to hear from y'all and in terms of what you're doing, how you're moving within the communities, navigating different relationships. And so, like I said, feel free to write that in the chat, and in the end, we'll go ahead and hopefully we'll have a couple minutes so that way we can go ahead and share to the greater group. But with that, Miss Erica is going to kick us off with our rural strategies.
Yep. Thank you, Fausto. I can't wait to hear what you guys all have to say. So yeah, now we want to share about how we are collaborating with either community health organizations, maybe health systems, or other key stakeholders in providing the better care and service to our communities. And of course, as we mentioned before, we are focusing on the rural population. as part of our rural health strategy, with the goal is to reach each member in the community, enhance our access and enhance their access, right, to healthcare. We want to connect with them, connect with more people, and improve the community engagement and be able to help with health education and literacy. So how are we doing this? Well, by building relationships with and collaborating with CBOs, that's community-based organizations, such as the ones that you see here on the screen. We make connection with them, and the definition of connection says that it is the act of joining or the state of being joined to something else, or the part of the process that makes this possible. So yes, by connecting with CBOs, it is crucial that we do so we can make things possible. So because we're not the experts of everything, we want to be the connection and the connector to the experts. So we rely heavily also on our collaboration with these community-based organizations. This enhances our effectiveness by complementing each other's services and extending our reach. It allows us to be in the field, to be where the people are, just as mentioned in the video, that just like it takes a village to raise a child, it also takes a village to reach optimal health. So as we are collaborating with different CBOs, we expand our resource access. We build these trusted connections with different locations, and this exposes us to a wide range of members in the community, whether it's different age groups, different circumstances and situations, and have this conversation with our community. And such locations that we are connected with our public libraries, our local public libraries. Libraries often serve as very many different purposes. People go there to study, to read, to learn. Maybe they use the public computers to look for a job. Some parents even take their kids to just have some quiet time and keep them busy. I don't blame them for that. And there's also locations where public libraries serve as cooling or warming centers, opening their doors and extending the hours for people who are dealing with climate emergencies. Libraries even serve as safe houses for those who are experiencing domestic violence. So we want to be there. Obviously, there's a lot of people there who need help, who are looking for help. Well, actually, yeah, they are looking for help. They're probably looking in a book. And hey, here we are, community health workers. So we want to actively look for these places where the members are, so we can bridge the needed information and provide them with that care. We are also connecting with our local senior centers. To me, this population with our senior centers is a special one because sometimes this population can go unnoticed, either due to isolation, mobility issues, lack of family support, leading to unmet health or social needs. So thankfully, though, these senior centers do provide this population with either hot meals, fitness classes, time for creativity, social events even. And it's really great for us to be able to partner with them because our goal is to add to the services that's already there. Our community health workers are reaching out to these centers, providing them with presentations, reminding them or letting them know that we're here to help, we're here to stay, and ensure that they are connected to their PCP. We want to talk to the seniors, learn their stories, what are their needs, connect them to their PCP, ensuring that they have the medications that they need, ensure that if they have any chronic conditions that they are educated in it. And that's what we're doing, and providing them with the tools that they need. Some of our CHWs also provide regular check-ins and go in and ensure that, if there's any other essential needs that, we'll be here. So I implore you to go out and explore what other centers are out there, where you can add to their services. Another location that we are expanding our collaboration is junior colleges. And I could be biased because I have teenagers myself, but the fact that we're reaching out to this younger generation or group of people is incredible. This population often faces unique challenges because they are navigating through this thing called adult life, and it's difficult. It can be very difficult. Some don't know how to maybe handle their finances, stress, mental health. There's a lot that goes into that. Balancing what is school, work, family. That can be very stressful for a person and can in turn really affect their well-being. So by helping them, we can help them navigate through the system and help them figure it out. Some may have never even made a doctor's appointment before because mom still has my insurance card. So we want to help them and connect them with these. A success story that was provided to me by our very own Ivory. She expressed to me that she did meet a young girl at the junior college, and she was experiencing homelessness. And I mean, can you imagine just trying to get an education, trying to be better, but had nowhere to sleep? So almost right away, Ivory was able to connect her with a shelter. So she was able to have somewhere warm to sleep or cool out here in California. Hopefully the AC was on, but eventually she was able to be sheltered, which was great. That's a success story. And hopefully she's gonna get her connected with an apartment close by the college. So big ups to all the things that you guys are doing, that we're doing here in junior colleges. Again, that is a great population to ensure that we are connected to. So don't limit yourself. Don't limit yourself on what you're capable of doing. Because even though some people may look young and they're thriving and they're laughing and doing well, you don't know until you have this conversation with them. So it's important to ask questions when you get to know what they're doing. That way, you know what tool you need to pull for your toolbox to be able to make magic happen. And we have a couple more to share with you, but I will let Fausto share those. Fausto?
Yes, thank you, Miss Erica. And we also wanted to highlight one of our CHWs in Barstow, Miss Joyce, who identifies as Native American. And this is important because within our CHW work, visibility among our own cultures and communities allows for us to connect and let the members see themselves within us, right? The CHWs. And this CHW was able to connect with the Riverside, San Bernardino County Indian Health Inc., being able to provide resources for that community population. And it's very beneficial because if any members in those communities need to be referred to someone, our CHW in Barstow can provide assistance to those members and non-members, right? And so a lot of times when folks are trying to reach out for resources, one of the biggest barriers or issues that folks come across is being scared, being not having the trust to be able to vocalize that they actually need help, that they actually need support. And so that's why, visibility among our communities, among our members is important because then, it creates that rapport, it creates that connection point, and it allows the members to see themselves through us. So, and in this next slide, here in the Coachella Valley, our CHWs have also been able to connect with the local homeless rescue mission to provide one-on-one support to community and IEHP members alike. And having CHWs placed at the local rescue mission, we are able to support community and IHP members navigate programs either within the rescue mission or provide internal referrals for folks to receive assistance that they need. And so for us, this has been a huge success for our team and the community, given that our team is able to attend 3 weeks out of the month to break down any barriers of access to services and resources for folks within the homeless and at-risk population. And this is big because sometimes in these rural areas, it's hard to make a connection with the member, being that there might exist a gap in being able to connect directly, especially from a health plan. Our HQ is about an hour and a half from, we work remotely right now, and we're about an hour and a half away from our HQ. And so, to have our ourselves, the health plan out here, being able to put a face to a name, uh, is able to connect directly, uh, and through our own initiative, like some of my team, Jen and Emilia, we can bridge ourselves to these gaps, be a connection point, and at the end of the day, create a meaningful impact. And so I'm always looking forward to hearing Jen and Emilia's experiences at the at the Coachella Valley Rescue Mission, because they're known as the IHP people. So, you know, uh, we out here trying to just, do our best. So, uh, And so in this next slide, we also wanted to just mention how here in the Coachella Valley, we've been able to establish relationships with food distributions like Food Now, which serve thousands of people here in the Coachella Valley, including unhoused and homebound populations. And so I know we mentioned Bienestar and our collaboration with Bienestar. And so um, there's once you reach a certain point within the Riverside County, um, it, it's we have to then kind of build other collaborations and connections with other food distribution, just because of the reach and the geographic location of everything. But um, CHWs and being able to connect with folks at these food distributions like Food Now, um, we're able to really connect with folks and really listen to their needs and support in whatever way we can. And mind you, Desert Hot Springs is a community that struggles with homelessness, poverty, lack of resources. And so being able to talk to folks, we ourselves, even though we're from the community, still learn and are able to understand, in what capacity our work can have an impact on these folks that come looking, for food and support. And so just to give a snapshot of Food Now's work and what that looked like, we gave a little bit of numbers for Bienestar. And so for Food Now, the latest month that we have for numbers is May. And so Food Now was able to serve about 1,800 households with 5,200 individuals. And that's the total family members in a household. And they were also able to serve 350 homeless community members and around 620 housebound food boxes. That's where Food Now delivers weekly food boxes. So, you know, as we continue through this work, as we pave our paths, you know, like we've mentioned many times, it does really take a village. And so not limiting ourselves to, the work that we're familiar with, but pushing ourselves to be comfortable with the uncomfortable and building these relationships, being able to establish this rapport so that way, we're able to impact community members in such a way that is both profound and meaningful. And so, as we finish this presentation, we want to thank everybody for the patience, for your presence, and just for simply being here with us today. We do have a small quote here, and every day we bridge the gap between individuals and the systems that serve them. And as community health workers, we are not just health workers, we are partners in the journey of health. In every step we take as community health workers, we navigate not just the healthcare system, but the lived realities of the communities we serve, especially those of color. And so these communities face barriers that are complex and deeply rooted in historical and systemic inequalities. But by acting as advocates, by acting as allies, we commit to breaking down these barriers and forging paths to equitable health access, right? And so, you know, as we finish up, may we continue to be the beacon of empathy and action, transforming challenges into opportunities for wellness in every community. And so, we have a small quote here from the famous American anthropologist Margaret Mead, and it goes, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And so we are Connection Point. And with all of that, again, we're just grateful to be here today to share with you all the amazing work that our CHW team here in the NN Empire is doing out here in the Southern California region. And even though this work feels never ending because of the needs within our communities, I just want to remind folks, that this is hard work, trabajo de corazón. And we hope that as we all continue to develop and keep at this work, that we're also taking care of ourselves and that we're filling our own cups. So, Miss Erica, any last words to finish up this presentation?
Thank you, Fausto. Yeah, go get them, Tigers. We can do it. One person at a time. No, and I did want to let you know, I was actually in preparing myself for this presentation. I just finished an audiobook called Flaming Hot by Richard Montañez. It is a great book. I recommend it. But in the book, he said that opportunities are often disguised as problems. Learn to see the potential in every challenge. So that is who we are as community health workers. We help our members to see the power of positive perspective, that it can get better, that you don't have to be in this way, let them see beyond their neighborhood, or that the world is big and we're ready to help them to see the greatness that they can be, whether it's through health and anything else. We provide them with the tools and the resources so they can face these challenges and be able to thrive. In the book, he also said that, this one's my favorite, with every setback, it's a setup for a comeback. So yes, it's not easy. It's not easy to just be out there and always give for others. But just remember, again, fill your cup, empower yourself, recharge. That way you can be ready and prepared to empower other people. So 1% at a time, yes, we can. We can definitely do it. So thank you again for your time. We love you from California, Inland Empire. Thanks.
Appreciate y'all. And we hope that y'all enjoy the rest of the conference. So
do we have time for any the chat?
It's unfortunate. I think we are nearing the closing session, so I don't know if we'll be able to get to any questions or anything. Okay. But we do want to thank you for an excellent presentation.
Thank you.
And thanks everybody for joining and participating. I briefly mentioned in a chat a few minutes ago, but if you missed it, basically we're going to start the closing session here in about 2 to 3 minutes. So I will post that link again. If you navigate to the Notchville Unity link, scroll to the bottom, there's a click to join link, and that'll should send you to the closing session.
Thank you, Robert. Appreciate it.
Thank you, Robert.
Thank you, guys.
All right. Appreciate everybody. Much love coming out from Southern California, and we look forward to seeing all of the amazing work that all of you are doing in your respective areas. So much love, much positivity, and like Erica said, go get them, Tigers, Tigresses.